I'll just give it a minute to see if anybody jumps in.
Mm-hmm.
We may have a group of recording people today.
Yeah, no problem.
Hello everybody and welcome to the latest Allied Health virtual conference. Today's conference is Telehealth and How To with the lovely Karen Finnin. So I'd just like to go over some housekeeping before we begin. The chat function over to the right of your screen will be used today. So if you have any questions about the topics that we're talking about, please feel free to ask them along the way, and we'll ask them to Karen at the end of her presentation. So I'd now like to welcome Karen Finnin. Karen is a physiotherapist and the director of Online Physio. Karen specialises in providing long-distance physiotherapy consultations to people who have trouble accessing traditional care. With over 20 years experience as a physiotherapist, including a master's degree in musculoskeletal physiotherapy, Karen has worked in many rural and remote areas from country Victoria to the Northern Territory and Southeast Asia. Karen is our self-confessed digital nomad, and we're very excited to hear from her today. So without further ado, over to you, Karen.
Well, thank you so much, Chris. It is great to be here. So let me just get a bit of screen sharing going on, and we will get the PowerPoint up and running for you all. So just sharing now, and just let me know, Chris, when you can see that on your screen there.
That's perfect.
Fabulous. All right. Well, look, let's get straight into it. And so thanks so much for the introduction, Chris. Perhaps I'll just share a little bit more about myself. I am a physiotherapist and I completed a master's in musculoskeletal physiotherapy through La Trobe Uni. And I'm also the director of an entirely online physio practice, which I know what it sounds like and I know what you're thinking. We'll talk a little bit more about that in a sec. I'm also a founding member of the International Society of Digital Medicine. I also work with the Australian Physiotherapy Association advising on telehealth issues, and I'm also part of a telehealth task force, and that is defining telehealth in physiotherapy for the World Confederation of Physical Therapy. Now that all may sound very fancy, but it certainly hasn't always been that way, and so I thought I'd just share a little bit about my grassroots side of the journey of what got me to this point. And it started off in a little country town in Victoria. This was dairy country, and being a city girl born and bred, this was my first job out of uni, and it was my first lesson in the unique challenges that people in rural and remote areas face. One of my early patients, I recall, was a dairy farmer, and for those of you who haven't come across farmers, they're as tough as they come, and this chap was experiencing some low back pain. And me being the new peachy keen physio told him he did need to do some rest from his work duties to help it to get better. Well, of course, he was a dairy farmer. It was calving season, and his laughter at my comments could pretty much be heard around the whole town of 6,000 in Kyabram in Victoria. Simply not an option for him to rest. So I continued to work and learn more about the needs of rural and remote people, and then I did some travelling. And I ended up in far north Queensland, in far north Northern Territory in Darwin. And that was where I guess I really noticed the expanse of our country and how far some people need to travel for healthcare. I recall having a patient at the sports medicine practice I was working at. She'd had an ankle injury. And so I had to guide her through her first stage of rehab. As we were leaving, I mentioned, and if you can pop back next week, I'll give you a progression on your exercises. But she said, look, I'm probably not going to be back in town for another 6 weeks or so. It takes me 8 hours to get here. So I suddenly turned around, took her back into the treatment rooms and gave her a series of progressions to do for her exercises to keep her going for the next 6 weeks. So again, it really showed to me the challenges that some people have in accessing healthcare. From there, I then travelled over to East Timor, which is a small developing nation off the coast of Darwin. I headed over there because my boyfriend, now husband, he's also a physiotherapist, and he was contracted to the Australian Army over there. And so he was working on an army base. I had to keep myself busy. So I opened up a little private physio practice, the first ever in East Timor. And my patients were the range of expats and volunteer workers, people in the AFP, in the UN, a lot of people who'd traveled to East Timor to help in the development of the nation. And so for 3 years, we successfully ran Physiotherapy Timor and treated the needs of the expats with their injuries from potholes and motorbike accidents and whatnot. And then after 3 years, it was time for us to move back to Australia. Now, I felt a huge duty of care to these people that I'd been able to help in East Timor, and I wanted to be able to continue to help them if I could. I said to my husband, I think that I can still help these people if I'm aware of their symptoms. I can come up with the diagnosis and I can give them a rehab program to continue on their own. I said they don't need me necessarily to put my hands on them. They just need the right information so that they can get better themselves. So my husband, in his infinite wisdom, said, that's a great idea. You should do it. And so I really sort of thought about it, and I thought, well, look, this really could be something here. There's a recurring theme that I kept finding in all of my jobs, and that was a lack of access to quality injury management in rural and remote areas. When I looked into it a little bit deeper, what I realised was this. Approximately 1 million people in Australia every year would find themselves in a remote location with a musculoskeletal injury. And this was just Australia. It's, of course, a phenomenon repeated around the world. Now, traditionally, these people would have three main options available to them. They could travel long distances to seek healthcare, like my friend in the Northern Territory. They could Google generic health information online, but we do know that this can be ineffective or at worst unsafe. Or they could just do nothing about their injury. And this was a very common one. They would just leave it, let it get better on its own. But we know that this leads to poorer outcomes and greater recurrences. So with all that in mind, I set up Online Physio, an entirely online physiotherapy practice. So I think at this point, it's important to note that, first of all, I developed it to fill a need rather than to attempt to replace anything in the face-to-face world. I also knew nothing about technology or websites or anything like that. And in fact, I wasn't even sure what the concept of telehealth was all about. So I had to get my head around the terminology. And so this might help you too to sort of sort it into your own mind. And this applies to all of the allied health sort of world. So the terms, global terms, e-health and digital health, they're sort of umbrella terms to refer to anything technological or digital applying to the health industry. Now, a subset of e-health or digital health is telehealth, and this is consultations provided at a distance. Now, with the terminology out there, it's generally split into two areas. Telemedicine tends to refer to the medical profession, so GPs and medical specialists. They tend to use the term telerehabilitation for telehealth in allied health. Now, for a long time, this was the term we had to use because it was what was known, but there is starting to be a little bit of a shift. As I mentioned at the start, I am part of what's called a telehealth task force, and that is key decision makers in the UK, in America, in Canada, in Australia, outlining and defining what telehealth means for the physio profession. And we all didn't feel that we resonated completely with this term telerehabilitation or telehealth. Telehealth, tele is quite dated. It reminds me of telecom or telephones. And of course, it's way much more than that we do online these days. So the term that we have come up with, and this is very recent, very new, literally in the last few weeks, is digital practice. So digital health practice or digital physio practice, digital practice with speech pathology, those sort of things. So although telehealth will continue to be the term most commonly used, it's my view that digital practice will be a terminology that starts to phase in. So I'm going to be using the two interchangeably. So we've defined digital practice as healthcare services, support and information provided remotely via digital communication and devices. So a term I often use to sum it up is an online health consultation or an online physio consultation. But depending on your allied health profession, there can be various other aspects to that. So what am I talking about when I refer to digital practice? Well, this can be going through the consultation process using things like video, which is the most common one that people know about, using voice or audio calls, using web forms, secure web forms, and of course, good old-fashioned email. What we use these media to do is to assess, diagnose, and treat, except for the fact that the therapist is in a separate location to the patient. Now, another term that is often used in the telehealth space, or terms, is synchronous and asynchronous. So online health consultations can be one or the other, or a combination of both. Synchronous means you and the patient are there at the same time exchanging information. And an example of this would be on a video call. Asynchronous could be, for example, that a radiologist reads an X-ray and sends a report back to the doctor or the patient, and they've done that at a separate time to when the patient is receiving that report. Now, at Online Physio, we do a combination of the two. So we collect some subjective information at the start before we get involved, and then we do a video call. But we'll talk a little bit more about that as we move on. So, of course, the benefits for the patient generally are pretty obvious in terms of most people think of improved access. So, like I started with, people in rural and remote areas. But in this digital age, of course, we do value convenience. So for some people now, it's not that they don't have a health practice up the street, but it's that I want to do it at a separate time, or I don't want to have to fight traffic and sit in a waiting room. And, you know, if I'm waiting for an appointment, I'd rather be doing it in the comfort of my home office instead of sitting out in a waiting room with dated magazines. Another benefit is better consistency. We all move around, both therapists and patients, more than ever. And so digital technologies give us the ability to perhaps continue a patient relationship or continue a therapist relationship while we move around. So there's better consistency. It promotes independence. So independence for the patient to make their own decisions about when and where they have treatment, and increased flexibility. So for some, this can mean starting a consultation at 11 o'clock at night if they want to. In terms of the therapist, of course, the amazing thing is that therapists can now be free from their cubicle at a clinic at a set location. So they don't need to be limited to the four walls that they normally had been. It enables us to plug some holes in workforce efficiency. So, for example, there's a massive population of women who may have children and have a capacity to work, still have a wonderful brain, but need a bit more flexibility and perhaps more consideration around, you know, work location and being able to work from home. Benefits for the therapist can also be that if you have a great niche, you can now reach a wider audience. So say you lived in a big rural town and you were very specialised into golf injuries, say. There may not be a big enough population in that town to prop up your specialty and allow you to live that passion. But the online space allows you to potentially reach a much wider audience. And the better that your niche, the more you'll cut through with that population, and they will be getting the specialised care that they need. Of course, maintaining a caseload if you're moving around or relocating. And we've already talked about stay-at-home parents. For some, it can be that there are therapists sitting around without appointments and that an online consultation model allows them to fill those gaps. And also, something that's been really valuable is introducing so much digital technology into the consultation process allows you to standardise those pathways. So you can program and automate certain parts of your consultation that you simply can't do in the face-to-face space. So, of course, we think of rural and remote areas, we think of farmers, that sort of thing, but really there's an unlimited amount of populations that we're now able to reach if we're able to do these online consultations. Obviously, I started with expat workers, So people from perhaps developing nations with great access to healthcare moving to third world countries where they don't have that access. There's also big military populations. Think of being on a Navy ship for long periods of time. There's also remote industries. We know things like oil rigs, mining locations. They can be very remote, but still obviously need and deserve the adequate injury management. If that's the area that you're specialised in, it could be psych services, all that sort of stuff. Even just time poor people, as I said before, who don't want to be waiting in a waiting room or fighting traffic. People who are housebound, and this is more relevant for certain specialties within certain allied health professions. This can be more relevant. Obviously, we have an ageing population, so there's considerations around that. And now we're seeing this new population in the world of relatively permanent travellers and digital nomads. So these are people that can do all of their work from a computer. They don't need to be located in an office, and they basically move around the world. This is a growing population, and to give them consistent healthcare through the digital space is obviously of huge benefit. And this is a benefit that I've seen myself personally now, being able to work from my laptop. I'm no longer tied to a location. So I now, as Chris said at the intro, I do identify as a digital nomad myself. Okay, so I know what you're thinking out there. You're like, oh, this sounds all good and well. We get to treat people in distant areas. We get to get out of our cubicle ourselves. But does it really work, Karen? I'm sure you're thinking that. As health professionals, we always like to have evidence-based practice and some proof that these sort of things work. Well, I'm glad you asked. And I had to ask the same thing when I was starting online physio. In fact, I'd already put down a hefty deposit with the website developer before I even suddenly thought, oh my gosh, I'd better check and see if anyone's done any research into online consultations to see if they do indeed work. Fortunately, once I did a massive lit review, I discovered that there is some great research evidence out there. So what are the themes that the research is coming through with? Well, certainly in the physio space, and it will be interesting for you if you're looking to get into teleconsultations to see what the research is like in your allied health profession. But certainly in the physio space, they found that there was no increase in diagnosis error online than with a face-to-face assessment. So this is huge. So in a normal practice setting where we're able to put our hands on the patient, there is a certain diagnosis error. That error is no greater when we transition that assessment to the online space. So that's massive. We're just as accurate with our diagnosis online. What else did they find? Well, look, patients were more likely to self-treat. So we've increased their internal locus of control by taking the health consultation online. So instead of that feeling of coming in and lying on a treatment couch and being fixed, they now are being given the right tools that they need to get themselves better. So we're transitioning more into a coach role with this better sort of internal locus of control from the patients, which we all know is great for patient outcomes. The actual outcomes of the treatment, well, they found that they were similar or better than face-to-face care. And so in some cases, the outcomes were better because of that point we raised previously, which is patients being given the tools to self-treat and the motivation and the education to do that. Now, it's not all beer and Skittles though, of course, and what we did find that there were a few limitations. The outcomes seemed to be dependent on the clinician experience level. So, for example, if you were a new grad, your clinical reasoning skills wouldn't be as developed, and you're likely to face challenges when you take out the physical touch component of an assessment. On the flip side, if you do have that experience, you've developed your clinical gut, you're very used to sort of knowing what to look for, there's going to be more success with these online consultations. And this is certainly something that I've found, that I'm relying a lot on my years in physical private practice to now successfully adapt and pick up on the right things in the online space. So something to really consider. I don't know about the other allied health professions. I'd love to hear from you, but I know in the physiotherapy space, it's not routinely a part of undergraduate education to do a telehealth component at this stage. I don't think that's a big deal, because I do think people need to get some hands-on experience in the area that they would be practicing telehealth first. What else? Of course, not all conditions can be managed online. And we're very open about the fact that if we feel that we can't adequately manage someone online, we will refer them on to the service that is appropriate. Having said that, generally speaking, the conditions we can't manage online are the same ones that we as physios would refer off to a GP in a face-to-face clinic. So if they had certain neurological signs, we felt the condition was more medical and less musculoskeletal, we would be referring those patients on anyway. What personally we have found at Online Physio is that patients are relatively self-selecting. So they know that when they come to an online service, they're going to have to be more proactive about their health. So if perhaps there's someone who's just after a bit of a calf rub, they're potentially not the ones who are going to come and use our service. And look, the other big one, and this we may talk a little bit more about at the end, because it is a very common question people have. There's not a lot of acknowledged funding available for online consultations. So this is across the sort of the allied health field. I'm currently in discussions with some of the leading private health insurers regarding getting an item number for online consultations, but it is not currently in Australia approved for rebate purposes. Now, the psychs out there, I know that you do have some access to funding through Medicare. However, they are specifying that some of those consultations in a course of consultations or treatments do have to be in person, which I don't agree with, but that's something we've got to continue to work in. So a consideration, if you're looking to start online consultations, is that you have to be aware that initially at least, your patients may have to be privately paying to access the service. With that in mind, does that make the service viable for you to operate? So this is a really good time to stop and pause and say that we're not here looking to replace face-to-face consultations. We have no intention of doing that, and it simply won't happen. All we're doing is hoping to increase access where it is limited, increase access to specialised skills where people may not have access to those, and also open up some opportunities for health professionals that may not have otherwise been able to work. So we're very happy to refer to face-to-face services. We're not out to replace them. And we can happily coexist in this health profession. It's certainly not a one or other debate. All right, so I'm sure the next thing that you're wondering, especially the people in the more physical allied health professions out there, your EPs and that sort of thing, is how does a online physio consultation actually work? Now, of course, this is more relevant to the physio space. However, all the allied health professions out there, I want you to think about how would you go about adapting your face-to-face skills to the online space? Now, obviously, physio is one of the more challenging ones to convert over. We're traditionally very reliant on our physical touch. So if we can do it, you can do it. It just takes a little bit of lateral thinking. So let's just talk through what happens in the physio space, all the while you're thinking, how could this work for my health profession or your specialty? So to get started, what patients do in online physio is they would click on starting a consultation and they're guided through a series of questions. Now, typically we call this the subjective assessment. And in a face-to-face setting, this would be where we would sit with the patient and ask questions back and forth before we've even put a hand on the patient at all. There's a very fixed routine to follow with our subjective questioning. And this smart form that we've built guides people through that. And it is smart in the sense that depending on what they answer to one question, they will be guided in a different direction for the next series of questions. So it's not simply an online form where it's stock standard answers. This is an intuitive form that takes the information they're giving and then feeds them more questions that are relevant to that to get us all the information about their injury. There's things like rating their pain. There's things like talking about the factors that aggravate their injury. There's an opportunity for them to upload any x-rays or investigation reports that they've had, and plenty of space to put in extra ideas and comments and any other information that they feel we need to know. Once they click submit on this form, their payment is processed and we receive the subjective assessment form. The great thing about this form is they can commence it at any time without us necessarily having to be available. So this is what I was talking before about asynchronous components of the telehealth service. They feel that they can really put down all of the information that they need. They don't have to, watch their clock or look at the time. They can just take their time putting in all the information. So they really feel like we've got all the information. From there, we communicate with the patient. And the next phase in our physio consultation is the objective assessment. And this is where the patient goes through a series of movements to see if the reasoning that we've come up with through their questions is proven or disproven through the objective assessment. At the end of the subjective process, that first process, any good physio would already have a pretty good idea of what the diagnosis is. Regardless of online or face-to-face, you already would have an idea of diagnosis. So it's an important thing to remember that by the time we get to our objective assessment, this is simply confirming or denying that diagnosis, not to make one from scratch. We will guide the patient to go through a series of tests. We have safety messages built into the system, and we guide them through with pictures and videos a series of simple, safe tests that we've determined are safe because of the information they've already given us, and give us feedback on that. So this is all before we get to the video call. So now we have all the information that we need to decide, is this appropriate for for online physio or not? And of course, if we're not comfortable with managing them online at this point, we'll refer them on either to an in-person physio or to another medical service if we feel they need it. Then we get to the video call, and this is obviously where most people think of a consultation as starting, but it's important to put systems in place so that we make the video call more efficient. Because we have some great information already about their injury and their movements, we can use the video call to really get to know them, build a good rapport, ask any further questions that we have, and certainly, if we're very comfortable with it, come up with the diagnosis, give a really good explanation to that patient about what is going on with them. And that's where they can ask any extra questions. We can see any other physical things that we need to at the video call. Now, from there, a couple of things will happen. We'll first of all send through a summary report about the consultation process that we've had. And this will outline the issues that they're facing, what we feel their diagnosis is, their probable diagnosis is, what their goals of treatment are, and the steps that we're going to take next to get them better. So that really empowers them, feeling that they've got a summary of where they're headed. We then move on to the rehabilitation plan, and we use an exercise prescription app called PhysiTrack to do this. This will show videos of the exercises and descriptions. It will put in, we tailor-make the number of reps of each exercise that we want the patient to do. They can rate their pain each day and send us any questions that they have through the app. Once we've issued them with the rehabilitation plan, we have to put a structure in place to make sure we follow up. So we will give them a cue, such as, let me know in a week how you're going with these exercises, or contact us before that if there are any issues. Now, PhysiTrack also has an inbuilt secure messaging system, just like you would text messaging, but it is secure and built into the platform. And so that is a great way to now have a direct line of communication with our patient, so that they can ask questions and we can reply to them when it's next convenient for us. So that's an outline of the online consultation system. That's how we do it. There's obviously lots of different ways that it can be done, but sometimes a great starting point for how to work it out for yourself is to see an example of what someone else is doing. So I hope that's been useful and helpful for you. Now, of course, there's a few things to consider when we're talking about taking our health profession online. So there's a lot of safety considerations involved, and this is usually a big part of the questions that people have for me. Is it safe? You know, am I going to get sued? And so basically the considerations I see fall into three main areas. There's the legal side of things, there's the tech side of things, and then there's the clinical side of things. So let's talk a little bit about these. In terms of the legal side of things, well, we've got a lawyer who's written up our terms and conditions and terms of use on our website. So that's one first step, and that's obviously something we then guide people to. By reading past this point, it's assumed you've read and accept our terms of use. Now, it's certainly not watertight, but to the degree to which the law will allow us to be indemnified, those terms and conditions do that. We have a custom clause on our indemnity insurance, ensuring that we're covered for online consultations. Don't assume that they're covered by standard in your indemnity insurance clause. Now, as well as that, in a legal sense, we have all exactly the same standard professional requirements. So our duty of care to our patients is the same. Our need for CPD and continuing education is the same. Our need to maintain strict confidentiality is the same. So for all the things that we do have to consider in the online space, what we draw it back to always is, what would you do in your normal health profession to make sure this is safe for you, safe for the patient, and put those things in place. Now, if we talk about the technical side of things, well, one of the upsides of the online consultation model is that you do have the ability to have a 100% record of all the interactions. So by the time video calls are recorded, messaging is obviously digitally recorded, you have clinical notes, any sort of communication back and forth. So this is something that certainly can't be said of the face-to-face space. So in that way, much more safe in the online space. You also need to be using secure practice management softwares. All the sorts of things that you would do to protect patients' information normally is the same. But I guess the word of warning is, you're only as strong as your weakest link. So if your password is on a post-it note at the bottom of your computer screen, it doesn't matter what systems you're using if that is accessible by other people that can access the system. So just be smart about the tech, the gadgets, protecting passwords, and making sure that only people who need to access that patient confidential information can do so. From a clinical perspective, this is obviously going to be a little bit different for each different allied health profession. But a few things that we have found we've put in place. We have what we call a low threshold to refer. So we would refer on if we had any doubts at all. That just maintains safety. Whereas in a physical clinic that you might just hang on to them for an extra treatment to see how they go. Obviously in the online space, we're removing a few of our ways to obtain feedback. We do have a low threshold to refer off if we're not sure of anything. We put in injury-specific disclaimers. So the upside is, in the technical space, this is easy to do. So if anyone, for example, in the physio world is complaining of calf pain, we would put in a disclaimer saying that if you feel that your calf becomes red hot or swollen, seek medical attention immediately, because that can be a sign of a DVT, which is something more medically urgent. And at the end of the day, assessing the injuries, teaching the patients to self-treat their injuries, we're on the conservative side of things. Still effective, it's still going to get them better, but we're not going to be going in very vigorously, especially if we're not sure of their balance or their physical abilities. All right, now heading into the online space, particularly if your service is entirely online, as ours is, there's a whole new range of business considerations that do come into it. Pricing is a massive one, for example. When we first started, we did a simple conversion from the online space saying that if you have a video call with us, you pay per consultation. But what we found is that people use the service differently. So because they have that messaging feature with us, they're able to more frequently get in touch with us for smaller questions. Now, also in the physio space, because we're not seeing them in person, we're not padding a treatment, so to speak, with some hands-on treatment. It's all simply about proactive things that the patient can be doing. So we shifted our pricing model from pay per call to pay for a period of access. And that may include video calls, messaging, and unlimited tweaks to their program as they need it. The rebates is a challenge that we've mentioned before, and this will continue to be something that we will have to work on, not just for private health insurance, but also for compensable bodies, travel insurance, all of that sort of stuff. They are obviously very concerned about risk and the effect on their brand if someone has a poor experience. So we need to, as health professionals, make sure that A, we're making a really quality online health service, and B, that we put a few things in place to make these compensable bodies feel more comfortable with enabling us to do these online consultations. The other one is systems. So by the time you add technology to a consultation, it can become very arduous if you let it. There's time of setting things up, of testing audio, all of that sort of stuff. So if you don't build systems to make things more efficient, then it can be chewing up more of your time, and that makes it not a viable business entity. So just a few extra things to consider there. So we talked a little bit about pricing. How will people use the service differently once you're online? Are you pricing simply for time? Is it a price for time exchanged, or is it more on that basis of that episode? So we know that, somebody who's had surgery, for example, often it's a 12-week or a 3-month period that they need access to get to the point where they're back functioning again. So have a think about that for the conditions that you treat, or the sorts of conditions that you're managing. What is the pricing likely to do there once you take it online? We've talked about the different rebate bodies and how we're working through them. Now, we haven't even started with work cover and DVA and all of that sort of stuff. We're still back on the private health insurers. But obviously, once we find a model that the private health insurers are happy to run with, then that structure can be rolled on down to the other compensable bodies. So there'll be a massive turning point in the telehealth industry, or once rebates become available, because clearly it is more appealing for patients to do these consultations. And the systems. So make sure you set up systems to protect you safety-wise. So have you got the right disclaimers in place? Have you got the right clauses that people can approve before they head forward to know, for example, that their call is being recorded, that they can listen back to, of course, if they want to. Systems for automation, as I said, once you're managing patients online, it's very hard to forget who you're interacting with and when you need to catch up with people. So the more you can automate those systems, it does the thinking for you. And for efficiency, so that you can cut down on the time taken to do the peripheral admin side of the consultations, leaving you to simply put in the clinical time, the time that you've done your uni degree on, the real clinical intelligence stuff, rather than just faffing around with admin systems. In terms of marketing, well, look, it's really tricky, because the most common way that people find allied health professionals tends to be Googling their suburb name and the health profession. So it might be Aspendale exercise physiology. Now, when you're not linked to a location, suddenly this is different now. So you've got to be very clear on who your target audience is and how you can market them online. You've got to be clear on what your product structure is. So maybe it's that you need to offer some other online resources to fund the service, as well as just the consultations. We can look to the fitness industry and see how they're packaging that so well, online fitness programs and that sort of thing. We need to borrow a little bit of that courage, I think, to put our great quality information online into programs and stuff. Social media obviously makes the world go round, video content more than ever these days. So how are you making sure that you're earning the trust of potential patients out there, letting them get to know you and letting them know what value you have? Ironically, even though we see people less and less, we're connected to people more and more through a personal sense. So if they don't get a sense of who you are, they're less likely to want to use your online service. And content, it's great to produce some brilliant content so that people can find that information if they're searching for it online, to then discover that you also offer an online service. One of the last things I'm going to talk about is the digital patient journey. And this is something that we've been working on over the past sort of 5 or 6 years that we've had our service running. Someone said to me very early on, when they had a look at my system to give me some feedback, is they said the less clicks, the better. So of course we want the experience online for the patient to be very easy. Each time they interact, it should be very clear what their next step is, or what our next step will be contacting them. So once they submit a form, they should immediately know what to expect next. If we get in touch with them, we need to tell them, expect this in such and such a time frame. So everything should be seamless, and we want to reduce the friction in the system. When you start out, you can be using a few different separate sort of systems. And if you haven't got automated emails and the like set up, it can be very clunky for the patient. So I think moving forward, with a lot of competing services now starting to pop up, It's the ones that give that ease of use to the patient that will do better. So what now for digital practice? Well, look, a big part of my time these days is spent on advocating for rebates. So I've been in discussions with some of the leading private health insurers and also working with my professional body for them to do they're doing some fantastic advocacy at the moment in the digital health space. We need to grow the industry, and this is across all allied health professions. We need to work together to build trust from our patients and potential patients that online consultations is a really viable model of doing healthcare. Fortunately now, a lot more health professionals are getting on board and are convinced of its use and application, but we all now need to educate the patient population or the health consumer population to that. At the end of the day, one of the most important things is that we don't get into online consultations so that we can work from a banana lounge in Bali, although that can be a fringe benefit. It's that we've got to solve problems for our patient. Introducing technology does create challenges, but our patients will push past them if we're really tapping into a problem of theirs that we have to solve. So make sure that that's the reason you get into it, that you've identified a hole, a need, a reason that they will want to communicate with you online. If you set it up for purely a lifestyle perspective for yourself, you're likely to have a really hard battle in terms of marketing and convincing patients to come and use your online health service. So look, I hope you found that really interesting. I think my message at the end of the day is that the online health consultation model can be so fabulous in so many ways, but we have a real duty of care to keep these things high quality. I say that beauty happens at the intersection of automation and personalization. If it's too automated, it's impersonal and the patient won't have buy-in. If it's too personalized, it'll be inefficient and it'll take too much of your time and it won't be a financial viable business model for you. So if you can hit that sweet spot between personalization and automation of an online health consultation model, it can really open up a whole new world for both you and your patient. If you've got any questions, this area of healthcare always raises questions. I'm obviously more than happy to be in touch with you and to answer those. So yeah, maybe we should put it out, Chris, and see if any questions have come through.
Yes, they certainly have. Well, thank you firstly for that presentation. It was very thorough, and I think there's a lot of gold sitting in there for anyone who has been sitting on the fence or, doesn't really, just had a lot of those questions about taking the leap and also understanding what the digital practice will look like in 6 months, 12 months, 5 years. For me, is very exciting to see where we can take this as an industry and the value that it adds to traditional health services. For me is amazing. And like you said, someone who is traveling a lot can still have that connection with their physio no matter where they are in the world. So, that's kind of taking the whole social media platform environment and applying that to health services, which is just fantastic. So thank you for all of that. The first question that we have is just referring to your subjective assessment form and the platform that you used to make that look so pretty.
Yes. So that is Typeform. So that is a form building cloud-based service that I subscribe to use. And that allows you to build smart forms that have split responses. You can do your own design, and it feeds one question at a time. That's a really important part of it, I found. It's not overwhelming a patient and it's more conversational. One of the best things about it, Chris, is that in the first question, we ask their first name, and then digitally I'm able to then insert their name into the process further down the track. And that is what I was talking about between automation and personalization. Yeah,
it's beautiful. It's for anyone who wants to create forms that have that kind of human aspect to them and the way that they flow. Typeform, I've just popped it in the comments there, typeform.com is what you absolutely need to get your head around. And as a platform, it can also accept payments and a few different things along the way, depending on what subscription level you have. But, for surveys and feedback, I don't know if you use the same platform, Karen, but it's perfect.
I do. I use it for so many things now that I have the base of it for the practice. I know that it's on tap there, and I do use it for a lot of different things now. Even like, quick quizzes and surveys that I can put out into social media of, is laptop use harming you and that sort of stuff. So a lot of applications for it.
Yeah, and I think they recently upgraded, and it's a bit more fun. It's kind of, you can have little thumbs up or star ratings and things like that for surveys. So it's a great platform to kind of get your head around and work into your potential or existing digital practice. Another question that we have, and this does come up a lot, and it's about the terms and conditions on your website. So everybody should have this anyway, and I know that a lot of people don't. But it's something that, especially if you're looking to do online consultations, please refer it off as you would a patient. Refer it off to the expert. Would that be your experience there?
Yeah, absolutely. And obviously this is more your area of expertise, Chris, but I just knew that I needed to build something into it. So I literally went to a lawyer, an IP lawyer, I think it was, and I just said, what should I put on here? This is what we'll be doing. How can you help us to be protected in the way that we should be? I didn't know anything about it. So as you said, outsource it, ask the questions. Look, it's something that we just had to get done once, and then it's there forever. So definitely worthwhile.
Yeah, absolutely. Another question that came through is building the digital practice with a physical practice. So adding that as an extra value. Do you see that there's space for that?
Look, it's a tricky space for sure. And I think this is where it's really important to see what need is the online component fulfilling? What problem is that solving? Because let's face it, if a patient has a choice between exactly the same thing happening in person or online, because of tradition, because of a number of different reasons, they will gravitate towards the in-person sort of service. So what is it about the online component you would introduce that makes it better, that makes it fill a need? Is it that you're now broadening your geography with a certain specialty? Or is it that I can now reach an unserviced area of rural and remote population? It will take a different tack of marketing to what you've traditionally done. It may take a slightly different target audience to who you would traditionally market to. So don't expect both to coexist and be on the same footing and be successful. Think about what's different about that service and how you can reach a different group of people with it.
Absolutely. And one thing that you mentioned before is testing, and that's one of my favorite words. Testing, and just involving as many people as you possibly can to, especially for something like a digital practice. The more you can practice and test those automations, the better before we kind of launch it.
It's so true. And right at the start, if I had, as any health professional out there, I'm sure can attest, you always have friends or relatives giving you a call or a message saying, oh, I've got this niggle or I've got this thing going on. And you know what I would say? Great, jump online, do the form, go through the process. I obviously wouldn't charge them, so I could test the system. And it kind of actually gave me more information than I would have probably just on a casual chat with a friend anyway. So that was an absolutely crucial part of the process. And yes, I certainly gave a lot of free treatments to family, friends, to contacts, friends of friends, just to get the system streamlined before I was sort of opening to the paying public. So yeah, definitely.
Yeah, absolutely. I have a couple of questions around like payment platforms. So, there's quite a few out there that link into the different systems.
Yeah, that's right.
Stripe and PayPal and a few. So is that, would you use a Stripe or a PayPal?
That's right. Yeah. I started with PayPal. I've now transitioned to Stripe, which, as you indicated before, ties in beautifully with Typeform. And that's how we do it. So Stripe is embedded into our Typeform, and that's how we process it. I've had more and more, I'm going to be open and say I'm a sugar-coated sort of person normally, but I've had more and more challenges with PayPal of late. Their system is becoming very clunky. It's less user-friendly than ever. And Stripe sort of come in and really streamline that process. There's far less friction for me. So that's the one that certainly gets my vote.
Yeah, yeah. Now, there's a question around what platform that you use. Now, I do know that you've written an amazing blog post around all of the different pros and cons of the different softwares.
Oh, video platforms.
Yeah.
Yes. Yep.
Yeah. So I think what we might do is we might include a link to that blog post.
Absolutely.
Because that will go into way more detail than we can dive into now around, what's right for you, because it is going to be what's right for you.
Yeah, that's right. I've got a couple that I work with, but new ones are popping up all the time, and every health profession may have different needs. So that article goes into think about, the aspects of what you need, and these are the things that you can that you consider. I'm happy to share. PhysiTrack that I use for exercise prescription does have a video feature that I do use. And then the other one is Coviu, C-O-V-I-U, that is a health-specific online video platform with, some great health-specific features. I know they've done a lot of work with speech pathology, for example. So they've developed a lot of sort of key features that are tailored to health as well. So it's not a blanket, as you said. It may be different depending on how you're going to be using it. Also, where in your journey you are. A lot of people started with Skype. We probably can't do that anymore in terms of what we know now about safety. But there's a lot of options out there. So that's a great idea, Chris. We'll link to that blog where it sort of spells out the way that you should think through what platform to choose.
Yeah, absolutely. And one big question and a common theme, I guess, and you must come up against this all the time, in the fact that you're looking to move and work with people in rural and remote areas. It's kind of a two-part question in terms of internet services and the technology at the client end. So firstly, internet.
Yeah.
Have you had many problems with that?
Absolutely. Yeah, definitely. And, we've been running for a number of years now, and obviously back then the internet was poorer. And part of my real motivation early on in the way that I set things up was that I didn't want to be solely reliant on just that video call to do the whole consultation for that very reason. And there are even people early on, not so much now, but there were people early on that I managed their injuries completely start to finish without a video call because we weren't able to access one. But there were digital images, they could record videos and send them through, and we had all those sort of forms and information available to us. Yeah. So I think that's something to be really mindful of as well, is how would this run if the video call couldn't work, or if you had more limited information that you could glean from that physical call.
Yeah.
When your whole reason is to give people access where they otherwise wouldn't have it, you've got to consider all of that. And that is, let's find a way. If there's no way that we can get on a video call, let's find a way. Yeah,
absolutely. And then obviously the ability to use technology by the client. Probably,
yes. Yeah.
That's another barrier.
So one of the things that I actually talked about in the blog on how to select a video software, part of the reason why I love the other platform, Coviu, so much is it's one link and the person will be straight into the call. So there's no download requirement, and that's a lot easier for people. So that's an example of the small considerations that we make.
Yeah.
Now, early on, I was also looking around at what equipment was available. And I think there was this wave of very high technological equipment that people could install to do these consultations. But I really peeled it back to, let's just use the webcam. I can measure joint angles by taking a screenshot of where you're at. I don't need a special high-tech tool to do that. Yeah. So another big motivation was, let's strip it back. Let's keep it simple. I don't want them to have any particular equipment apart from what we all normally have. Fortunately, cameras are built into pretty much everything these days. So, that's how we're able to do it rather than relying on, complex sort of machinery or technical equipment. Having said that, every health profession, is very different, and there may be different aspects that you need. I know some telehealth services operate out of a GP clinic, for example, where there's a room equipped for that consultation. But for the bulk of probably the people watching, they may be private practitioners who are just looking to sort of get started. Certainly don't create any more barriers than you need. See what you can do with the simple equipment that most people would have available so that we can reach all those people rather than make it complicated.
And so let's say you've got a really challenging client, a farmer has no idea, I'm profiling heavily right now, has no idea
Mm-hmm.
how to use the iPhone that's been sitting in his drawer because he doesn't know how to use
Mm-hmm.
it. Is that more of a on the phone type of scenario? How you kind of, manage that barrier?
Well, right at the start, before we went live, Chris, do you recall that I exchanged mobile numbers with you?
Yeah.
Always have a backup has become my mantra. And of course, I've learnt that the hard way.
Yeah.
The good old-fashioned phone line is the most essential and basic thing that you need, and is built into all our forms. So we always have their mobile number, just to get a port of communication through, because there are so many things you can talk someone through if you've just got that single line of communication with them. I must say, for our population that we service, it tends to be sort of 25 to 45-year-old white collar type people who use technology. But we need to be open to the fact that a lot of the services that will be very effective and really feel a need may not be the case. It may be in aged care or whatnot. So I think you have to factor in the education factor to your timeframes and your financial viability, but it becomes even more crucial to be using much more simple systems.
Yeah, absolutely. Well, I think we might wrap it up there because I think we could chat all day. Thank you so much for sharing your expertise with us. It's been amazing, and absolutely all of Karen's links are there on the screen for us to see. Please feel free to get in touch with her directly or email us and we can kind of put you in touch. So I'd like to thank everyone for joining us this morning, and thank Karen once again for sharing your online physio journey. And I'm certainly looking forward to what you achieve in the next 3 to 5 years. I think it's going to be amazing.
Thank you so much, Chris. It's been an absolute pleasure, and I hope you guys have found some of that useful out there.
Thank you.